All right, today we are ready to talk about Dr. Ryan Reeves, and I would like to start with Miss Cassie Arnold. Go ahead and tell us how you came to Dr. Ryan Reeves.
I went online looking for a way to get my teeth whiter, and I picked out 3 names, and I went to each of them, and hands down, Dr. Ryan was my choice. I didn't know the extent of what I would need to do to regain my health and the beauty of my teeth, but I have found out over the past many months, and here's the result.
Well, they are absolutely beautiful. You're beautiful. Tell me about your experience. Tell me about your first time coming to Dr. Ryan Reeves.
My first time was when I asked him if he could lighten my teeth, or, I thought, oh, maybe I'll get veneers. And he spent probably 2+ hours with me showing the lay of the land inside my mouth, and that I really had a health problem, not just an aesthetic problem. And that was a kind of malocclusion.
Mm-hmm.
My bite was off by 0.5 millimeters, something minute but significant.
So you weren't even aware that you had neuromuscular problems?
Right. Yeah, I had an old-fashioned retainer, which was basically just like a hard wall.
Mm-hmm.
It wasn't refined to my bite. It just covered to prevent grinding.
Mm-hmm.
And I actually had so much wear on my teeth that they were short little teeth. And through the course of the evaluation, he presented me with my options.
Mm-hmm.
And I knew very shortly that, bleaching or veneers, none of that would really do the job, that I need some neuromuscular restructuring.
Instead of just covering up and doing patchwork, you wanted to solve the entire problem.
Do the hard sell,
Mm-hmm.
but he did say that veneers would be time limited because the same wear pattern would happen. They might fall off or not really be worth the investment, and even veneers are an investment.
Oh, absolutely. And how was the experience that you went through over the past year?
Dr. Ryan?
Mm-hmm.
Well, he became a very integral part of my life for a while, and
Absolutely.
I had to turn over my body, mind, spirit to him in trust, and he earned it every time.
Mm-hmm.
Very, very careful, very perfectionistic, which means that he can attain to a high standard of his dexterity, as I've spoken about before, is incredible. His eye, he's great at hand holding, but he keeps his professional focus. My whole family comes now. That's another testament.
Absolutely, absolutely. And how have things changed for you since you've had your full mouth reconstruction?
Well, I think it's really a subtle transformation. It's hard to say. It's just that it's something I don't think about anymore, so it's not something upon which I get hung up. And we were just talking about the little unconscious ways of covering up your smile,
Mm-hmm.
or holding back. I noticed that I can get closer to people, and I can smile and reach out to people through the smile and through the eyes, and stay connected without getting overwhelmed with the self-consciousness, self-judgment, that kind of thing that people just do so automatically. I mean, I still do it, but not really very much at all, because what it did is show me that that's just so self-defeating and unnecessary. It's just a bad story that we tell ourselves. I don't know if I would have changed the story if I hadn't gone through this process and been given this beautiful gift, this smile.
Mm-hmm.
But it's been profound but subtle.
Well, that is wonderful. I thank you for talking to us, and you absolutely look gorgeous, Mrs. Arnold.
Thank you.